Welcome back to INCMED. In this FMGE Orthopaedics Rapid Revision series, we will cover some of the highest healed fracture, nerve injury and dislocation facts frequently asked in FMGE, image-based questions and clinical scenario. Let's begin. Clavicle fracture, most common fracture in children. Middle 1/3 is the common site. Scaphoid fracture, most common carpal bone fracture. Proximal pole is prone to avascular necrosis. Bankhart's lesion, anterior glenoid labrum, tear seen in anterior shoulder dislocation. Hill-Sachs lesion, posterior lateral humeral head compression, defect associated with anterior shoulder dislocation. Axillary nerve injury, surgical neck fracture causes deltoid paralysis and sensory loss over the regimental batch area. Radial nerve injury, midshaft humerus fracture classically presents with Wistrop. Colles fracture, distal radius fracture causing the characteristic dinner fork deformity. Smith fracture, reverse Colles fractures producing a garden spade deformity. Supracondylar fracture, most common elbow fracture in children, may injure the anterior interosseous nerve. Posterior shoulder dislocation, classically associated with seizures and electric shock, often visible on a anteroposterior X-ray. Oakman ischemic contracture, results from forearm compartment syndrome, most commonly after supracondylar fracture. Monteggia fracture, fracture of proximal ulna with dislocation of the radial head. Galeazzi fracture, fracture of distal radius with distal radioulnar joint dislocation. Dinner fork deformity, classical deformity seen in Colles fracture. Garden spade deformity, classical deformity seen in Smith fracture. Avascular necrosis, femoral head is the most commonly affected bone, especially after the neck of the femur fracture. Posterior hip dislocation, hip lies in flexion, adduction and internal rotation, sciatic nerve may be injured. Anterior hip dislocation, limb lies in extension, abduction and external rotation. Sciatic nerve injury, most commonly associated with posterior hip dislocation. Scaphoid AVN, proximal fragment undergoes avascular necrosis due to retrograde blood supply. Dashboard injury, classically causes posterior hip dislocation with posterior acetabular valve fracture. Fat embolism syndrome, presents with the triad of hypoxia, petechiae and confusion. Fat embolism, most commonly occurs after the long bone fractures, especially femur fracture. Compartment syndrome, earliest clinical sign is pain on passive stretch. Remember the 6 P's: pain, pressure, paralysis, paresthesia, pallor and pulselessness. Osteosarcoma, Codman triangle is a classical X-ray finding due to periosteal elevation. In osteosarcoma, sunburst appearance of X-ray, distal femur is the most common site. Ewing's sarcoma, onion scale periosteal reaction is a characteristic radiology finding. Traumatic fat embolism, petechial rash over the chest, axilla, conjunctiva is a highly characteristic. In compartment syndrome, fasciotomy is a treatment of choice once the diagnosis is established. In Ewing's sarcoma, characteristic translocation is T11 to 22 producing the EWS-FLI1 fusion gene. In this, on-skin periosteal reaction is a classical X-ray finding. In this, commonly arises in diaphysis of long bone and consists of small round blue cells. In multiple myeloma, presents with punched out light lesion and Benstor's proteins in urine. It's most common primary malignant bone tumor in adult above 40 years. In giant cell tumor, soap bubble appearance and typically involves the epiphysis of long bone. In this tumor, treatment is curettage followed by bone grafting. In osteochondroma, most common benign bone tumor is cartilage capped exostosis. In chondroblastoma, typically occurs in epiphysis of skeletally immature individuals. In chondrosarcoma, malignant cartilage tumor showing popcorn calcification on X-ray. In osteomyelitis, Staphylococcus is the most common osteoorganism. Sequestrum, dead bone fragment surrounded by pus, characteristics of chronic osteomyelitis. Involucrum, new bone formed around the sequestrum. Broodiapsis, subacute osteomyelitis presenting as a sclerotic lesion in X-ray. Salmonella osteomyelitis, classically associated with sickle cell disease. Cloaca, opening in the involucrum through which pus drains. Pot spine, spinal tuberculosis is most commonly affects the lower thoracic and upper lumbar vertebrae. Gibbs deformity, sharp angular kyphosis due to vertebral collapse in pot spine. Cold abscess, tuberculous abscess without classical signs of acute inflammation. Paradiscal lesion, most common radiological pattern in pot spine, causing disc space narrowing and end plate erosion. Osteoporosis, Most common metabolic bone disease diagnosed by DEXA D score of less than minus 2.5. In this, common fracture sites are vertebrae, neck of femur, and distal radius. In osteomalacia, defective mineralization of osteoid with increased ALP and PTH levels. In this, looser zones or pseudofractures are the pathognomonic X-ray finding. In rickets, characteristics by cupping, fraying, and splaying of the metaphyses. In this, the classical signs includes craniotapes, rachitic rosary, Harrison sulcus, and genuvarum. In patched disease, shows markedly elevated ALP with normal calcium and phosphate levels. In patched disease, cotton wool appearance of the skull is a classical radiology finding. In this, osteosarcoma is the most feared complication. In osteogenesis imperfecta caused by type 1 collagen defect with blue sclera and fragile bone. In this, type 2 is a lethal while type 1 is a mildest form. In achondroplasia caused by FGFR3 mutation leading to rhizomelic limb shortening. In achondroplasia, most common cause of dwarfism and inherited is a autosomal dominant trait. Osteopetrosis marble is a marble bone disease caused by defective osteoclast function. In this, bone-in-bone appearance in Erlenmeyer-Flask deformity or a classic X-ray finding. Hyperparathyroidism, subperiosteal bone resorption is best seen along the radial aspect of the medial phalanx. In this, brown tumors and salt and pepper skull are characteristic features. Renal osteodystrophy. Rogers-Jaegeri spine is a classical radiological sign. Rheumatic arthritis causes ulnar deviation, small neck deformity, and Boutonary deformity. In this, anti-CCP antibody is the most specific marker, while rheumatic factor is a positive in the most patient. Rheumatic arthritis, classical deformity of ulnar deviation, small neck deformity, and Boutonary deformity. In this, pannus formation destroys articular cartilage and commonly begins at MCP and PIP joint. In this, anti-CCP is the most specific antibody, while rheumatic factor is more sensitive. Ankylosing spondylitis strongly associated with HLA-B27 and typically affects sarcoiliac joints first. In this, bamboo spine on X-ray is due to the syndesmophyte formation. In ankylosing spondylitis, positive Swober test indicates reduced lumbar flexion. UAT is the most commonest extra-articular manifestation. Osteoarthritis. Heberden nodes affects DIP joints and Bouchard nodes affect PIP joints. In this, X-ray shows joint space narrowing, osteophytes, subchondral sclerosis, and subchondral cysts. In gout is seen in monosodium urate crystals are needle-shaped and negatively bifurcated. Podagra involves the first MTP joint, and tophy commonly occurs in pinna and olecranon. In pseudogout, calcium pyrophosphate crystals are rhomboid shaped and positively bifurcated. In pseudogout, most commonly affects the knee joint. In septic arthritis, Staph aureus is the most common causative organism overall. In septic arthritis, Neisseria gonorrhoeae is the most common cause in sexually active adults. In septic arthritis, synovial fluid aspiration typically reveals a WBC count greater than 50,000 cells millimeter cube. Developmental dysplasia of hip. Ottonelli test reduce the dislocated hip and produce a clunking. Barlow test dislocates on unstable hip and produces a clunk out. Perthes test. Avascular necrosis of the femoral head occurring in children aged 4 to 8 years. SCFE, slipped capital femoral hip phases, classically occurs in obese adults and boys. In this, ice cream slipping of the cone is a characteristic X-ray appearance and treatment in in situ pinning. Pediatric orthopaedics. SCFE is an obese adolescent boy with limp and ice cream slipping of the cone appearance on X-ray. In this, trithrovanin sign is positive when clinin lines fails to intersect the femoral epiphysis. Osgood-Schalter disease is a tibial tubercle apophysis seen in active adolescent boys. Blount disease. Tibia vara caused by abnormal growth of medial proximal tibial fascia. Clubfoot. Remember cave. Cavus, adductus, varus and equus. In clubfoot, Ponseti method is a serial casting is a gold standard treatment. In osteochondritis dissecans, Most commonly affects the lateral aspect of the middle femoral condyle. Nursemaid elbow. Subluxation of the radial head due to traction injury in children under 5 years. Pediatric fracture. Green stick and tarsus fracture or incomplete fracture unique to children. Salter-Harris type 2. Most common facial fracture associated with Tuston Hallon sign. Next, hand and nerve lesion. Carpal tunnel syndrome. So medial nerve compression at the wrist with the positive tenile and phalanx test. In this, thinner wasting and a weak thumb opposition and nocturnal pain are classic features. Ulnar nerve palsy causes claw hand involving the ring and little fingers. Frohman sign is positive. Irial nerve palsy produces wrist drop. Saturday night palsy is a classic cause. Anterior interosseous nerve palsy. Pure motor neuropathy causing weak pinch grip without sensor loss. Dupuytren contracture. Fibers of palmar fascia. The most commonly affect the ring finger. Trigger finger. Stenosing tenosynovitis involving the A1 pulley of the flexor tendon sheath. Decoerven tenosynovitis involves APL and EBB tendons. Finkelstein test is positive. Cubital tunnel syndrome. Ulnar nerve compression at the elbow causing sensor loss in the little and ring finger. Boutonity deformity. PIP flexion with DIP hyperextension due to central slip extensor tendon rupture. Next, spine. L4 to L5 disc prolapse. Compress the L5 nerve root causing foot drop and weakness of extensor hallucis longus. L5 to S1 disc prolapse. Compress the S1 nerve root causing loss of ankylosing reflex. Cauda-Equina syndrome. Bilateral leg weakness with bladder and bowel involvement in a surgical emergency. Straight leg raise test. Positive below 70 degrees suggests lumbar disc prolapse. Femoral stretch test indicates L2, L3 or L4 nerve root compression. Spinal stenosis causes neurogenic claudication related by forward flexion. Nose shopping cot sign. Femoral node is a herniation of disc material into the vertebral body through the end plate. Klippel fail syndrome, congenital fusion of cervical vertebrae causing short neck and low hairline. Sprengel deformity, congenital elevation of the scapula, often associated with Klippel fail syndrome. Spondylolisthesis, so most commonly occurs in L5S1 ischemic type, common in young adults. Congratulations, you have completed the FMGE Orthopaedics Top 150 must-know one-liners rapid revision. Revise this high-yield concept repeatedly because they are frequently asked in FMG recalls, image-based questions, and clinical scenario. If you found this revision helpful, don't forget to like, share, and subscribe to Increment. Thank you for watching.